Good afternoon, and welcome to the commencement ceremony of the Julia Jones Matthews School of Population and Public Health. I'm Jerry Carino, Dean of the Matthews School. Graduates, welcome. It is my honor to welcome our graduates, their families and friends, our community, and the community of scholars who have come to share in this celebration. It's also my honor to welcome our distinguished guests and the university officials who have come here to celebrate you, the graduating classes of 2024, December 2023, and August 2023. Here with us today is Dr. Lori Rice-Spearman. If you'd like to stand. President of Texas Tech University Health Sciences Center. Dr. Darren D'Agostino is Provost and Chief Academic Officer of the Texas Tech University Health Sciences Center. Dr. Deborah Burks, our newest faculty member at the Julia Jones Matthews School, is Presidential Advisor for Texas Tech HSC. Dr. Billy Phillips is our school's highest-ranking faculty member. He is a Grover E. Murray Professor of the university and is also the Executive Vice President of the Division of Rural Affairs. Dr. Rick Danko is Associate Dean for Academic Affairs. Students will also recognize our faculty. Public health faculty, please stand. That's what they look like in real person. We celebrate commencement at the end of an academic journey, yet the word itself, commencement, a time to commence, reminds us that this is not an end, but the beginning of a life's work, a career, a calling, in which we put science into service for people. Today's graduates have boldly faced and prevailed in an academic program of rigorous science, mathematics, project management, change strategy, policy development, policy analysis, and even a dose of individual and social psychology, to name a few. To those who walk this stage today, without a doubt, we are eminently employable. Today's graduates are the ones who will promote healthy lifestyles, research and prevent disease and injury, detect, prevent, and respond to the next outbreak or epidemic or pandemic or infectious disease, and mark my words, it's coming, and the ones who will save our neighborhoods and communities of West Texas, our great state, our country, our world, and will save us all trillions of dollars and countless years of life lost to death, disability, and disruption. Today's graduates are the unsung heroes of the bad things that didn't happen. Population and public health are all about community, collective action, and building one idea, one good idea, or innovation atop another and another and another. We at the Julia Jones Matthews School of Population and Public Health have been the beneficiary of such a community effort. We owe our very existence to it. 12 years ago, our community, folks like Billy Phillips, Chancellor Ted Mitchell, community members like Joe Ed Cannon, and of course, the Julia Jones Matthews family, had the prescience to build an institution. They foresaw an essential need, the need to prevent the bad things and the really bad things from happening, the need to promote health and wellness, not just to treat sickness after the fact, the need to understand deeply those behaviors and structures and environments and situations that yield good health or contribute to bad health. Ladies and gentlemen, through the vision and efforts of a few, through the generosity of the wonderful Matthews family in this strong community, and through the hard work of these graduates who will walk the stage this afternoon, West Texas and our world are a far better, healthier, and more productive place. To the class of 2024 and the December and August graduates of 2023, I offer my sincere congratulations and my thanks for all of you and for all you have done and all that you will do in your careers. I welcome to the podium Dr. Lori Ray Spearman, President of the Texas Tech University Health Sciences Center, who will deliver her President's Address. Dr. Ray Spearman.
Well, good afternoon. And on behalf of the Texas Tech University Health Sciences Center, we want to welcome family, friends, and loved ones to this celebratory day. Your graduates, some of them are already in the field, and they've worked very hard to come to this moment right now, today. So thank you for being here to support them. To our graduates, today marks a significant milestone, not only in your academic career, but also in your commitment to becoming a public health practitioner. You each have embarked on a journey with immense potential to transform lives and communities. And as we celebrate your remarkable achievements in earning your degree in public health, I am filled with immense pride and optimism for the future of health in our communities. However, it's imperative that we also take a moment to acknowledge a significant challenge before us: the stark reality of significant healthcare disparities in our rural communities. 1 in 5 Americans live in a rural area, but their negative health outcomes far outweigh those of individuals living in urban areas. Rural residents have higher rates of death from cancer, stroke, heart, and respiratory disease, and labor injuries. The statistics represent more than just numbers. They represent lives impacted, the lives of my family members and the lives of your family members. Rural communities often lack healthcare facilities and historically have faced chronic shortages of providers. These and other barriers to quality health care often lead to these poor health outcomes. Rural communities also have different population characteristics and exposure to risk factors, which create variations in disease and incidence and increased death rates. Understanding these differences can help reduce disparities, and you graduates are key members of the healthcare team uniquely positioned to make a profound impact on addressing these disparities. In your academic pursuit of expertise in population and public health, you've delved into the intricacies of health promotion and disease prevention. Yet your journey extends beyond academia, and it beckons each and every one of you to action. You are tasked with driving change, rallying for increased investment in public health education, and pioneering initiatives to address healthcare inequities. Each of you possesses the potential to shape the future of health in the sparsely populated rural areas across the 120 counties served by the Texas Tech Health Sciences Center, and in the condensed urban populations here and across our great state, nation, and world. Today, I encourage you to move into your careers as agents of change, equipped with knowledge and determination to confront all disparities. I also encourage you to carry forward the spirit of compassion, resilience, and innovation that brought you to this very place today. Next, I challenge each of you to reflect on the core motivation that led you to the field of public health. Your dedication goes beyond implementing interventions. It includes advocating for those who are marginalized. Your actions will inspire others, igniting a ripple effect that will extend far beyond the confines of this theater today. Finally, I ask you to remember that of the oath you take today, and that is to uphold the highest ethical practices, serve all communities with integrity and compassion, serve all communities and focus on health equity, and to use your skills to improve community well-being. I have complete confidence that this incredible faculty and our great university have prepared you for the road ahead, and that each of you will indeed significantly impact the future of health. You are now and forever a part of the Texas Tech University Health Sciences Center Red Raider family. Congratulations.
So many brought us to this day and to this celebration. Thank you to our faculty and our staff who have demonstrated tremendous resourcefulness and commitment to the mentoring and education of our students. I also acknowledge and thank our Chancellor, Dr. Ted Mitchell, our President, Dr. Lori Rice-Spearman, and our Provost, Dr. Darren D'Agostino, for their distinguished leadership and support. Thank you to the families and friends of our graduates for supporting them to hear this calling. You know what you did, and we do too. You sacrificed, you waited, you anticipated, you dreamed and aspired, and maybe even you cried a few times. I think that I did, and I probably will later today. We see you, we appreciate you, and graduates, let's give our family and friends and the faculty and our leadership a round of applause. Three graduates here today have distinguished themselves in areas that are very important to the industry and to those we serve: applied practice, community service, and overall public health excellence. Dr. Jeff Dennis of our faculty is the director of the Applied Practical Experience, APE or APE. It's a rite of passage for every student in our Master of Public Health program. Dr. Dennis has the honor today of presenting the inaugural Applied Practice Experience Award. Dr. Dennis?
Thank you, Dr. Carino. This year, the Julia Jones Matthews School of Population and Public Health established an award to recognize the graduate who produced the most outstanding applied practice experience. The applied practice experience is a requirement completed by all MPH students where they develop and direct their own projects with a partner community organization. So everyone you see here completed one of these. It is an integral component of the professional training in public health. It requires students to take the lead on a project under the supervision of a professional in the field toward the fulfillment of their project goals. This year, the recipient worked with the Waco-McLennan County Public Health District to develop a standard operating guide to test the use and effectiveness of artificial intelligence, or AI, in public health messaging. As AI has become widely accessible, the primary need for organizations such as health departments is to understand the benefits and limitations that AI can use in facilitating public health communication. This project demonstrated innovative application of public health tools and concepts toward the development of a protocol to help the health district better understand how to use AI effectively. It is my honor to present the inaugural Outstanding Applied Practice Experience Award to Alexis Grasso.
Thank you, Alexis. Thank you, Dr. Dennis. The Julia Jones Matthews Schools owes its existence to the generosity of the Matthews family and to the larger community. We're grateful for the support and endeavor to be uncommonly focused on community needs. Presenting the inaugural Outstanding Community Service Award, please welcome Dr. Courtney Queen, co-chair of the Julia Jones Matthews School of Population and Public Health Community Advisory Board. Dr. Queen?
Thank you. This year, the Julia Jones Matthews School of Population and Public Health established a new award to celebrate the public health values of community orientation and service to others, and to recognize the extraordinary support that our school has received from the communities we serve. Service is a calling that resonates deeply within the inaugural recipient of this award, and he believes that compassion lies at the heart of public health. He has and has been active in several and multiple community organizations, including Operation Brown Bag, Meals on Wheels, Care Pack for Kids, Operation Christmas Child, and Operation Blue Santa. While volunteering at vaccination clinics, he gained critical experience with prevention and helped to reduce the burden of infectious disease. He learned systematic project management and the deployment of emergency resources. He practiced outreach to vulnerable populations, and he witnessed firsthand the critical role of education and advocacy. He practiced outreach to vulnerable populations, and he witnessed firsthand the critical role of education and advocacy. As dually enrolled public health and pharmacy student who will be receiving his Doctor of Pharmacy degree 3 weeks from today, he discovered the deep interconnectedness between public health and clinical health care. The Outstanding Community Service Awards honors the student whose contributions to public health service in the community are of exceptional quality and impact. It is my honor to present the inaugural Outstanding Community Service Award to Traylor Moses.
Thank you, Traylor, and thank you, Dr. Queen. Next, I invite to the podium Dr. Billy Phillips, a Grover E. Murray professor, to present the Outstanding Public Health Student Award.
Thank you. Thank you, Dean. The Outstanding Public Health Student Award recognizes the student who best exemplifies the multiple intersecting aspects of public health and service to the population as a whole. This year's recipient has an exceptional scholar, a presidential scholar in fact, excelling in all of her classes while carrying a full workload. She completed a service learning project with the Rape Crisis Center. She engaged deeply in interprofessional education with colleagues across schools and campuses. She is a peer facilitator and officer of the Student Assembly and co-organizer of Public Health Week this past year. She also volunteers with Voice of Hope, a nonprofit in Lubbock. This year's recipient of the Exceptional Student Award exemplifies educational merit, contributions to the field and institution, scholarship, and community service. It is my distinct honor to present the Outstanding Public Health Student Award to Urim Inandar.
Thank you, Iram and Dr. Phillips. Let's give one more round of applause for our award-winning graduates. Dr. Deborah L. Burke spent her first career serving the United States as an Army colonel. Later, she ran some of the most high-profile and influential programs at the U.S. Centers for Disease Control and Prevention and the U.S. Department of State as a civil servant. Dr. Burks is known for successfully increasing overall effectiveness of programs through granular data use and effective change management. Graduates, you all know what that is. It's like what you studied for the last couple of years. Dr. Burks is a world-renowned medical expert and a leader whose long career has focused on clinical and basic immunology, infectious disease, pandemic preparedness, vaccine research, and global health. Dr. Burks served as the White House Coronavirus Response Coordinator, using complex data set integration to drive decision-making and working closely with state officials across the country to provide state-specific advice and guidance. In her second career, that's partly with us, she's applying the lessons learned from 4 decades of driving change management in the federal government and using data to drive continuous program improvements to important private sector endeavors. Dr. Burks completed her first book, entitled Silent Invasion, published by HarperCollins in 2022. She's a Bush Institute Senior Fellow and our newest faculty member here at the Julia Jones Matthews School of Population and Public Health. She's dedicated to transforming healthcare access in rural America, and we are privileged to have Dr. Burks on our faculty and to have her here with us today. Dr. Burks?
Thank you. You too can have an introduction like that when you're old. Thank you, Dr. Carino. That was really kind. And to Dr. Carino, the fellow faculty members who have really supported and guided these graduates, to Dr. President Rice Spearman, who leads a university that I can tell is not only dedicated to gaining knowledge, but really a heartfelt commitment to community. You could tell that in her speech. It is a privilege to be with all of you today. To the friends and families who supported these fine graduates, and mostly to the class of 2024, thank you for allowing me to share in your day. I really appreciate it, and really congratulations to all of you here. Yes, you're graduating from a school that honors an amazing woman. I appreciate that because I really do believe women make a huge impact, sometimes silently. Your school, the Julia Jones Matthews School of Population and Public Health, Miss Matthews, is described as a woman of vision and courage and compassion, but they always include that she had enthusiasm for living every day to the fullest, and that was an inspiration to all of her who knew her. Compassion, wisdom, philanthropy, and living every day with enthusiasm. You know she changed the landscape of Abilene, but now you carry with you that legacy of vision and courage and compassion. And you will be reminded of it every day, these core values, because they are on your diploma, which will hang in every office that you ever go to, and every time you turn to it. I hope you remember these values that go with you. A little bit of a story. I did start my career as a young Army physician at a dawn of one pandemic, the HIV/AIDS pandemic in the 1980s. And I finished my federal career with another pandemic, the COVID pandemic, in 2021. In the early 1980s, we were confronted with a disease that was killing young soldiers, sailors, and airmen across the United States and the globe. They came to Walter Reed with a mystery illness. We did not know what it was. In fact, it took us 5 years to find out that it was the HIV virus, and it then took us 11 years to develop an effective therapy. But this was an incredibly humbling experience for me, because I had trained in medicine and I thought I knew everything, like you do. And I thought I had really tackled medicine and all it had to offer, yet all of these 30 and young 40-year-olds were dying in front of me and I could do nothing. That experience in that moment of helplessness and humblingness created and ignited a passion in me that resulted in a 40-year commitment to stemming this tide of HIV and serving the impacted communities, and thus my service of 29 years in the Army, the State Department, and CDC. I want to take you back, though, to the 1990s, because we already had very effective treatment in the United States. This was developed and called the HIV cocktail in 1996, and many of my patients who made it to that dawn of that day are alive today, living into their late 60s and 70s like they've never had HIV. But taking you back to those 1990s, I was already working in sub-Saharan Africa, and those medications were not available there. In fact, there was nothing like those early days of the 80s that was confronting all the sailors and soldiers and airmen. And I really felt that something had to be done as wheelbarrow loads of mothers and fathers showed up at the hospital gates, and the matrons would turn them away. And I would say to her, "Why are you turning them away?" And she said, "Because if we save them today, they'll be back tomorrow and they will die. We have nothing." It was a crisis of really unimaginable proportions. There were countries where 40 to 50% of all the adults were already HIV positive. In this crisis of unimaginable proportions, the whole world remained paralyzed in inaction. Which goes to show you that data is never enough. Data must be combined with a leader who's willing to act. And then in January 2003, President Bush announced the President's Emergency Plan for AIDS Relief called PEPFAR. 21 years ago now. It was a beacon of hope in that sea of despair to many of us and certainly to the countries we served. Many people criticized President Bush and said, "You are taking on a challenge that cannot be achieved." Even some of his inside counsel said, "You will ruin your legacy as president because this will surely fail." Somehow he believed where there were not clinics and very few hospitals, fewer doctors, very few public health individuals, that he believed that the American people, through their taxpayer dollars and through American ingenuity, that we could change HIV/AIDS across the globe. And we did. Because he believed in us, we believed in us. And we now have 25 million people that have been saved, over 20 million on lifelong treatment, and 5 million babies born HIV-free. And I have been able to see those babies that were born now mothers themselves. The very tide of the epidemic has changed without a vaccine. And the rate of new infections has dropped by 50 to 60%, and the rate of deaths by 79 to 90%. This is a testament to you, but it's a testament of what Americans can do when we reunite. That program has always been a bipartisan program, bringing together both sides of the aisle. And it was that unity that allowed us to respond as the American people and turn our compassion into that beacon of light that still shines today. Fast forward, February 2020, I was in South Africa meeting with all of our 50 countries. We bring them in, 12 countries at a time, and we sit down and we go through every aspect of their program, where they're doing well, where they're not doing well, where we're going to really change things for the next year. While there, I kept getting these calls from the White House telling me, asking at the beginning, to come back to run the COVID response. I said no for many reasons. Many of them because I saw generals go into that White House and leave, and I thought if a 3-star general wasn't going to make it, a lowly colonel could not either. But needless to say, one Saturday night I got on a plane, and that Monday morning I was in the White House Situation Room. And like for all of you, it was a long year. But for me, it was a year of deep inspiration, because I got to travel to 44 states, and I got to travel to 33 universities. And I got to see the compassion of our students across this great country as they were in school. And in talking to the students and the presidents at one of these schools, they turned to me and said, "How could we not open? We had to open, because we have students here where this is their bed, and this is their food, and this is their employment. Yes, we educate young minds, but this is where people feel safe and ability to learn and have the housing and food that they need." The students rallied because many of the students who were really reliant on employment out in the community couldn't get jobs because many of the stores or some of the restaurants were closed. And so the students rallied and created a food bank. And every day made sure every student had what they needed to be successful. That is what was possible in that moment, in that emergency. And now I'm really deeply honored to come to Texas Tech, University of Health Sciences, and to this school to bring together what I have learned over these long years and to share with you that passion of translating knowledge into impact at the community level, to ensure that everybody can thrive, no matter where they live. But enough of my personal stories. I also love watching Letterman and his top 10, so I'm going to give you my top 10 quickly. Number 10, learn to collate. Let me tell you, no matter where you work, if you get that slide out of order or that piece of paper in that presentation out of order, the number one thing that they will think is you don't know how to do your job. So collating is very important. Number 9, nothing is beneath you. This has saved me. Throughout my career, I had to work. I worked at a diner. The diner happened to have a car hop. I also worked as waitresses all through college and medical school. But at this diner, we had to make the milkshakes as the waitresses. And I got very upset because you don't get a tip unless the milkshake's good. And the owner of the diner said, you cannot pour more than 1 scoop of ice cream. Well, you know what that would look like. So I used 3. He counseled me over and over and over again, and I still used 3. And finally he turned to me and he said, you know, the only thing that's keeping you from being fired is I watch you. Every night and every time you come in, you look at every salt shaker and every pepper shaker and every ketchup bottle and you refill all of them. So that is saving you, but still only use 1 scoop. I did not. I got better tips. 8, every decision is not life-defining. I know it seems like that, but it isn't. I can say that because I've lived longer, but life is just a series of choices and none of them is the penultimate one. 7, everybody has an opinion. It may not agree with yours. Please listen. That is where I have learned the most. I have learned the most from people who would disagree with me, who are willing to lay out their information, and so I can hear it and understand it, and I ask you to do the same. Number 6, just believe everything is possible. If you're the only one in the room that believes that, that's okay. I have never accepted no as an answer. I've gotten no maybe 20, 30, 40 times, but you know what? They always get to yes, I think because I'm annoying. 5, the internet does not hold the truth. Your interpretation, your ability to understand it, your ability to seek out wisdom for others, your ability to use your values will lead you to that truth. 4, always forward, never straight. I'm always veering off path a little bit, but I always have friends and family who get me back. 3, bring compassion and passionate about the world that you share. Be that beacon of light as the PEPFAR was for many across sub-Saharan Africa. Number 2, this is my favorite, be willing to fail spectacularly. I have. It has been my best learning experience. But number 1, which is critical, always nurture your friends and family amidst all the life trials because they're the ones that will not only walk beside you, but they'll be the ones that pick you up when you fail spectacularly or veer off track. Treasure this day and your new beginning and the new journey because your choices already show your commitment to others. Your choices show that you believe in the health of your communities, and I thank you for that. One final thought, because you live this and you live this intimately, we have a lot to learn from you. Because as I traveled to universities and talked to high schoolers, they really impressed me with their ability to pivot, their ability to be resilient, their ability to be adaptable. You're the ones that figured out how to stay in touch with each other, no matter the fact or the distances or the restrictions. You stayed connected. You engaged in virtual learning, something none of us really knew how to do before, and you supported your communities, your parents, your friends, your family through this difficult time. Yes, the world will always be changing rapidly, but you learned how to pivot, and you pivoted quickly, and you learned how to adapt. And that will no longer scare you. You will look forward into the unknown and know you'll be able to tackle it because you lived through the worst pandemic that we have had in 100 years, and you carry that ability to move forward despite obstacles. So as you move forward together, and as you continue your adaptation and your resilience and your learning, I leave you with the fact I'm still learning. I appreciate you teaching me. I appreciate the time I get to spend with people and talking. And I know you'll seize every opportunity that comes your way. So congratulations, and I just am excited about the unique contributions that you will bring to this world and this community. Thank you.
Thank you, Dr. Burks. I was taking notes during her top 10 list. We're now going to proceed with the conferral of degrees, and I'd ask for Dr. Rice-Spearman to come forward, please. Will the graduates please stand? President Rice-Spearman, degrees are awarded to those who have successfully completed all requirements established by the Texas Tech University Health Sciences Center and the faculty. On behalf of the faculty of the Julia Jones Matthews School of Population and Public Health, I present to you the candidates for the Master of Public Health degree and recommend each for conferral of the degree.
By virtue of the authority vested in me by the Board of Regents of the Texas Tech University System, I confer upon each student here today the degree for which the Dean of the Julia Jones Matthews School of Population and Public Health has recommended. Congratulations.
We will now proceed with the recognition of individual candidates. The following individuals are being awarded the Master in Public Health. Elbethel Biniam. Shnuthez Dudapali. Abigail Dominguez. Alexis Grasso. Emily Guerrero. Dr. James Mel Hayes. Aubrey Lauren Heller. Iram Inamdar. Dixon Kurgat. Amanda McKernan. Christian Morales. Traylor Moses. Jordan Myers. Amanda Nemariam. Oleyemi Emmanuel Olamakinwa. Agana Okiki. Joy Osaji. Cindy Giselle Pena. Dashunique Peterson. Emily Keeles. Lakin Ritchie. Rosalind Danae Robinson. Macy Sanders. Sandra Benavides Shimkus. Maddie Terry. Destiny Wells.
We're waiting for the final picture. Ladies and gentlemen, it gives me great pleasure to present to you the graduating class of the Julia Jones Matthews School of Population and Public Health. Please join me in celebrating the achievements of these graduates. Oh, we can do better than that. One of the wonderful assets of the city of Abilene is the Paramount Theater. It's my favorite place in the whole city. It's a beautiful old theater on the historic theaters trail all across the United States, and we are very, very fortunate to be here. We are also very fortunate that the city of Abilene is building back better in some sense, and unfortunately that means that the road is in a terrible condition outside, so we're not going to be going outside. Well, this happened about 2 weeks ago, so we had a little bit of, replanning to do. So we are going to ask your indulgence for the end of the ceremony. Following our ceremony, we ask that you remain in the theater while the students go to the back of the theater for some pictures and to pick up their degrees. We will then have a reception backstage here behind me, which means that all of you all get to come up on stage and feel a little bit famous for about 15 minutes, or as long as you'd like to stay. We're gonna ask people for safety purposes not to try to do the Rockettes line because you might fall off the side of the stage. Please, when you come to the back of the theater, we're going to lift up the curtain and you'll see our reception as the big reveal. When you come to the back of the theater, we ask that you not use these steps here on the side, but rather go to the very side of the theater and walk up the concrete steps, which are a little bit more stable than what we have here. So please do not use these steps. We're going to have people manning those steps to make sure you don't come on up. We're going to ask that you instead come to the reception through these side doors here. There's an area in the back of the lobby designated to take family and friends pictures, and upstairs there are some wonderful backgrounds for you to take photos, and also the TTUHSC Spirit Shop is upstairs from the lobby where items are available for purchase. Thank you all for attending. Please stand for the recession of our leadership, faculty, and graduates.